Hi there, it's Dr. Flynn with 96th Street Chiropractic. I want to take a moment right now to give you all an office tour, show you around, let you know what we do here. So when you walk in, you'll notice that to your left, you'll see this spinal nerve function chart. So this chart is a great resource to help educate and indicate the areas of your spine and how misalignments can have symptoms. For instance, the top bone in the neck, C1, affects headaches, migraines, dizziness, allergies, neck pain. Several different conditions are caused by misalignments in this area. So this chart is a great resource to identify how your spine is related to your entire health and function of your body. So this is our exam and x-ray room. Our primary goal is to identify what is the cause of your problem. So in our spinal exam room, x-ray room, we perform a consultation history to gather more information about what's bothering you. And we also perform a spinal exam and x-rays if necessary. So several things in this room allow us to find out exactly the cause of your problem. So one of the most effective tools that I utilize in the exam is what we call spinal palpation. So what I'll do is I'll identify, let's say for instance you're having neck pain. I'll actually apply pressure, feel around the joints, feel around what kind of movement you have, and this helps to identify how your spine is moving, functioning, if there's pain, tenderness associated with that. That oftentimes is indicative of misalignments of the spine. What we call bilateral scales. So we have our patient step on these scales. We should be balanced. We should have 50% of our weight on either scale. And this helps to identify if there's more pressure on one side versus the other. So another tool we utilize is what we call spinal EMG. And a spinal EMG is very similar to an EKG for your heart. An EKG identifies electrical activity that's going on with your heart. Abnormal electricity in the heart can identify certain heart conditions. It's a common thing that's done in the hospital, in a doctor's office. The spinal EMG is very similar to that, and it helps us identify where there's problems along the spine. So it's a quick, easy, simple test that's pain-free, that it helps to identify where your problems are in your spine. So spinal x-rays help us to identify the condition of your spine and also where we may see misalignments. And this is a very helpful tool that chiropractors utilize to assist with helping your problem, identifying what the problem is, and formulating a plan on getting you back to health as quickly as possible. And here we have one of the most important tools that we utilize in our office, and it's really the prime focus on what we do as chiropractors to help your body heal naturally. And this is an adjusting table. And this is a table where you will lie comfortably, and we apply our gentle adjustments to specific areas along the spine. There's multiple techniques that we use. One would be a traditional chiropractic adjustment, hands-on. We have gentle tools as well, instruments that help patients that may need a more gentler adjustment. We have the one on the right here. It's called an arthrostim. It applies gentle pressure, rapid electrical impulse to the spine. And then the instrument on the left is what we call an activator. That's an adjusting tool that is very gentle, very precise. It's one-click action. And these are some tools that we utilize. It's not our primary focus, but it's a tool that we can use in the event that somebody needs a gentler adjustment. And here what we have are two intersegmental traction tables. These are tables that are very gentle, very comfortable, very effective with helping to increase mobility, spinal motion, decreasing pressure and tension along the spine. We oftentimes will do this prior to an adjustment. Heat and ice are commonly applied while you're on this table. Patients absolutely love these tables, and it's a great way to assist with your healing. You lay on your back for 15-20 minutes, then thereafter you'll go into the adjustment room, and that's where we perform the adjustment. This is our spinal decompression table. Patients experiencing low back pain, neck pain, stiffness, typically discs that are degenerated, bulged, herniated, patients with sciatica. This table does a great job with providing negative pressure, opening the spine, decompressing, giving the discs more room to take pressure off the nerves. This therapy is a 20 to 30 minute table. This is our spinal decompression for the cervical spine. The table setup is just a little bit different. Same thing occurs here. We open, separate, relieve pressure from the spinal discs and joints. So we look forward to seeing you here in the office and helping you get back to health and freedom as quickly as possible.